Hey guys, so in this season of transition, as I establish myself here in Fort Lauderdale, I've decided that I'm doing it messy, but I'm doing it anyway. So the videos may not be as polished, the backgrounds may not be as pretty since I'm still living in boxes, but I definitely still wanted to bring information to you. And so today's video is going to relate to the headlines that are coming out recently about Kourtney Kardashian and Travis Barker and their pregnancy with her being 44. Now, obviously, we don't know their story, but we can talk about what it's like getting pregnant in your 40s. So I wanted to spend a little bit of time today just doing a deep dive on that and just chatting with you like I would a patient in the office. And what we know is that at least with today's science, we are not able to reverse the ovarian aging process. So let's talk about ovarian aging for just a little bit. We know that women are born with all the eggs they're going to have in their lifetime. And we know that until about age 35, roughly, there is really sort of this minimal fluctuation or decrease, but the outcomes and the numbers remain fairly stable. Now, once the patient begins to age above the age of 35, we begin to see a very real and a very well-established decline in fertility. And so what we see is a decrease in the number of eggs that we are working with and also in the quality or health of those eggs. Now, egg quality, at least right now, there's not a test for us to measure that. So quality is really inferred based on the patient's age and any other risk factors that she may have. Think of things like endometriosis, or if she was a longtime smoker, any toxin exposure she may have, etc. But quantity we can measure. And so if you're seeing a fertility specialist, this may be something that they talk to you about. Egg quantity is looked at by markers of ovarian reserve. So this is what is the number of eggs we have remaining in the ovaries. There's typically 3 ways that that can be checked. Your doctor may look at all 3 of them, may look at 1 or 2 of them. 2 are in blood. So 1 is AMH, or anti-Mullerian hormone. Anti-Mullerian hormone is a hormone produced directly by the ovary. So it's a direct reflection of ovarian activity. And so the higher the AMH, the better. Of course, just like with anything, too much can also be bad, but we like to see a robust AMH number. The second hormone they may be checking is called FSH, or follicle stimulating hormone. That is typically checked cycles day 2, 3, or 4, when cycle day 1 is your first day of full flow. And FSH is always checked with estrogen level as well. So you may have 3 hormones checked here: AMH, FSH, and estrogen or estradiol. And then the third marker of egg reserve that's not in blood is a vaginal ultrasound. The vaginal ultrasound is looking at the antral follicle count. Think of the ovary like a chocolate chip cookie. We're looking at the amount of cookie and we're looking at the number of chocolate chips, okay? And so that is a visual or imaging marker of that same ovarian reserve parameter. So when we talk about ovarian aging and we talk about a decrease in fertility, we see that the AMH, the FSH, and the follicle counts begin to decrease steadily and continually over time as that patient increases above age 35. Now, once she hits above age 40, we know that that decline is much more dramatic. It's much more acute. And so the numbers drop much more quickly. Now, some stats that I like to give when it comes to quality is pregnancy outcomes. So a fertile woman, she has 2 kids, she's trying for a third. Her likelihood of pregnancy at 35 is approximately 20% per month. That same patient, by the time she's 40, her chance of pregnancy per month is 5% per month. So 20%, 5%, just in a span of those 5 years. We also know that the risk of miscarriage increases significantly. At 35, risk of miscarriage in that young, healthy, fertile female is going to be around 10 to 12%. By the time she hits 40, it's going to be closer to 40%. The other stat that we look at is the risk of genetic issues or birth defects. So when you look at genetic anomalies at delivery, we know that at 35, risk of Down syndrome is roughly about 1 in 400 deliveries. By age 40, it's roughly about 1 in 100 deliveries. So again, these numbers are so drastic in such a short amount of time. Now imagine beyond age 40, right? Those numbers occur much more acutely. So what I always tell my ladies who are seeking pregnancy after age 40 is that you really want to seek out the help of a fertility specialist as quickly as possible. Not because you can't get pregnant, right? Because age is not the only predictor. It's not a guarantee of lack of pregnancy. But purely based on the information that we do have, we know it's going to be an uphill battle. And so why not use those resources and seek out that help sooner rather than later? So I hope this has been helpful. If you want to work with me or find out how to work with me, be sure to go to my website, drcarolinasueldo.com. You can shoot me a message and we can get you scheduled. I am serving patients through telehealth here in the state of Florida. And I am also still connected to my former practice in California, Women's Specialty and Fertility Center in Clovis. So if you're a California patient, you can definitely book an appointment through them as well. Be sure to hit me up. I would love to hear what you thought of this episode, and I will see you next week. Bye-bye now.